Greetings from the CareConnections team. My name is Steve Pearson, the product manager for CareConnections, and I'll be taking you through the process for eliminating paper forms for outcomes and patient satisfaction. Notice that we'll sometimes refer to our electronic collection platform as a kiosk application. When we say kiosk here, we don't mean an independent behemoth of a station for patients to interact with, like what you see in an airport. Kiosk simply refers to the electronic collection of data. Most clinics employ this functionality by using an iPad or other tablet-style computer that can easily be handed to a patient. The purpose of this training is to help you make this transition and understand the benefits of doing so. At the end of the presentation, these are the things we want you to walk away from with a better understanding. First, the benefits of changing from paper to electronic completion of outcome information. Second, understand that there will be a change in your workflow to accommodate the process. Note that change in workflow doesn't necessarily mean a lengthier process. Hopefully, it will be a much shorter process in the end. Third, we'll go through how you do it, how you set up your tablet, how you queue assessments, and how you use the different features related to electronic collection in CareConnections. Finally, we'll cover some of the challenges you'll face in this transition and help you to prepare for them. Your biggest incentive is time savings for you and the patients involved. You no longer have to print paper forms, you don't have to manually score and enter the data from the outcome forms, and you don't have to mail patient satisfaction surveys to us each month. All of these functions are handled automatically. Next, electronic collection ensures that you will have better data integrity, which basically means you don't have to worry as much about scoring errors. All outcome fields are automatically scored as soon as the patient completes them, so you don't have to manually add up the patient function responses, convert it into a percentage for your function score, measure your pain line with a ruler, and then accurately key in the results. The fields listed here now get scored and entered automatically for you. This image shows the evaluation portion of a registration where you would typically be hand entering these scores. Notice that the relevant fields here are pre-populated with the patient responses scored for you. If you've been in the habit of scanning outcome forms into your EMR, you can eliminate the scanning step. Both the assessment history, which shows you the patient's responses from the electronic assessment, and the registration summary documents can be saved as PDF documents and directly uploaded into your EMR. The benefit of this step is to give therapists access to the documents when treating patients, without them having to log into a website. When you switch from paper to electronic, your workflows will need to be adjusted. With paper, data entry sometimes happens closer to the end of care. Forms completed on paper need to be scanned and imported into medical records. They need to be manually scored and input in the CareConnections platform, and patient satisfaction surveys need to be compiled and mailed monthly in order to be included in quarterly reports. With electronic data collection, your workload shifts to early in care. To begin collecting outcome data for a patient, you first need to create a registration for the patient in CareConnections. This serves as a placeholder for saving outcome data. Once a patient completes an electronic assessment, you'll have access to summary documents from CareConnections, the assessment history and registration summary, that can be uploaded into your EMR system. All the values collected on the patient assessment are automatically scored and entered into the appropriate fields in your CareConnections registration. And if you collect patient satisfaction surveys, those can be queued up electronically for the patient as well, so you don't have to mail anything to us at the end of each month. How do you get started? The next series of slides are going to show you a series of screens from CareConnections that will help you to visualize the process, beginning to end. First though, you'll want to think about when you want patients to be completing their assessments. Before treatment, or at the time they arrive for treatment. CareConnections allows you to email assessments to patients in advance of their appointment, and it also allows for patients to complete assessments at the time of treatment in your clinic. Even if you choose the email route, you'll still want to have something in your clinic for patients that don't get the email in time. So, your first step is to set up a device for collecting assessments in your clinic. The next few slides will cover that process. The next step after setting up your device will be to start queuing assessments for your patients to complete electronically. This will be covered after we look at how you set up your device in the clinic. The example screens we have here are taken from an iPad, but you can do this on any computer or tablet that has an up-to-date web browser and a connection to the internet. We recommend something that has a touch screen since that's easier for patients to interact with. The first thing you'll do is open your web browser on your device. Supported browsers for this application include Safari if you're using an iPad or other Apple device, Mozilla Firefox, Internet Explorer, or Google Chrome. Your device should be capable of receiving system updates that allow it to continue to install browser updates. Otherwise, you might not be able to access the kiosk site. Start by keying in the URL for the CareConnections kiosk site as pictured here, https://kiosk.careconnections.com. Note the HTTPS. If you don't include the S, then the site will not load. Once you've keyed in the URL correctly, you'll be brought to this page. This is the patient-facing page that patients will see when you either email their assessment to them prior to their appointment or when you give it to them in the clinic. The next thing you'll do is create a shortcut to the kiosk site for quick access. On an iPad, you'll click on this symbol here, and notice the row of icons on the bottom of the menu. Add to reading list, add bookmark. You'll need to scroll this menu to the right to find what you're looking for. You're looking for the Add to Home Screen option. Touch on that. By default, the shortcut will be named CareConnections, but you can name it whatever you like. Just type the name on the line above the URL here. For this presentation, we named the icon Patient Kiosk. Once you have your name keyed in, touch on Add. You now have a quick access icon that will take you directly to the Patient Kiosk application in CareConnections. Note that this is not an actual app. It's just a shortcut to open your web browser and open the Patient Kiosk website. When you touch on the icon, the website opens as pictured here. Note that if you click on the drop-down list here, patients can select between English and Spanish for their assessment. Keep this in mind if you log patients in for their assessments before handing over the iPad or other device to the patient. You can't go backward to select the language after the patient is logged in. You're all set for the patient to log in for their assessment. A 4-character access code will be generated that you can look up in your CareConnections account or that the patient will have access to if you email the assessment to them. We'll cover this in more detail in a moment. Once logged in, the patient will be asked to select the region of their body with which they're having the most difficulty. We suggest that you at least speak with your patient about this before emailing them their assessment or before handing them a device in your clinic. Some patients may need a little guidance with selecting the appropriate body region or not adding additional body regions. We've built in some functionality that at least helps with this. As long as a patient's actual problem area is near the area they choose, they'll receive a few extra questions that will cover that area as well. For example, hip, leg, knee, ankle, foot shares questions with lower back. If the patient selects leg because they feel shooting pain in their leg, and the therapist determines the actual diagnosis is the lumbar region, then the function score will automatically update when you select the anatomic group and problem area later in the registration process. The other areas where questions are shared are arm, shoulder, elbow, and neck, middle back. If you run into a scenario where a patient completely selects the wrong thing, you'll have to re-administer the evaluation assessment for them. More on this later. Once the problem region is selected here, the assessment continues just as it would on the paper survey, with the patient receiving instructions and then one question per page. Is everyone still with me? We're just about halfway there. Now that your device is all set up and you've seen the patient side of things, it's time to figure out how to queue your first assessment and start collecting data. To do this, we'll walk you through how to create a new registration and complete the minimum number of fields that will allow you to save it. This will be the demographics phase of the registration, which requires 4 fields. With that, you'll be able to queue your first assessment. Once logged into your account, click on the New Registration button. Patient ID, date of birth, gender, and the initial evaluation date are the required fields you need to save a basic registration. If you provide the patient email as well, you'll have the option to email assessments to your patients when you queue them. Once you enter your patient info, click on Save Changes. After saving, you can click on the Treatment Registrations link to return to your active patient list and find the record you just saved. Your next step is to queue an assessment for the patient you just entered. To do this, right-click on the patient record in your active patient list and select Queue Patient Assessment. Note that you can only queue assessments for the current date or future dates up to 7 days in advance of the appointment. For a new patient evaluation, your outcome tool will be set to the default and the assessment type will be Evaluation. Note that you also have some options to consider here. When using electronic collection, you can choose to include some supplemental outcome tools, which include the patient-specific function scale and the Fear Avoidance Beliefs questionnaire. Unless therapists in your clinic are interested in collecting this information, you can leave these blank. However, if someone wants to use these additional tools, simply check the box next to the ones you want to include. Remember that if you include the patient email when you created the registration, you can check the Email to Patient checkbox to have the assessment automatically emailed to your patient. When all of your selections are made, click OK to continue. Note the check mark that now appears in the queue column for the registration you just created. This means that the system is ready for the patient to complete their assessment. If you didn't email the assessment, or if you have a patient come into the clinic who didn't complete the assessment that was emailed to them, you'll have to look up the access code needed for the patient to log in and complete the assessment in your clinic. To do this, click on the Patient Assessment Queue link. The number next to this link tells you how many patients are currently queued to take their assessment. The Patient Assessment Queue shows the 4-character access code you need to log the patient into their assessment. While you may choose to give the access code to your patient, we recommend you log the patient in. On your iPad or other device, enter the 4-character access code along with the patient's date of birth. If you need to select a different language, go ahead and do that as well. Let the patient know you've entered the login for them, but give them the opportunity to read the instructions before they actually click on the login button. Now the patient is set to proceed through their assessment. Once the assessment is complete, note that the check mark has been cleared from the queue column. This is a visual indicator for you to show that the patient has completed their assessment. At this time, you may wish to review the responses, print the results for the therapist, or save the results for upload into your EMR system for the therapist to review. To do this, you'll again right-click on the patient record. From the right-click menu, select the Print Assessment History option. The assessment history document shows you all of the individual responses from the patient assessment and also gives you the summarized scores in the upper right-hand section. Note that some of these sections will not have scores until you collect your first follow-up assessment later in treatment. This document will have a new page added to it each time a patient completes their assessment, so it will become a running history of the assessments collected throughout the patient episode. So far, there's been very little data entry to get the first assessment completed, but now you need to plug in some more information to complete the evaluation portion of the registration. We recommend doing this within at least 2 days of the evaluation so that it doesn't get lost in the shuffle. The information you complete at this point will include the payer detail phase, pictured here, diagnosis, and intake phases. Starting with payer detail, you'll enter in the patient's insurance payer and plan, the referring practitioner, and the treating practitioner. Once complete, click Next to save and proceed to the next step. On the diagnosis phase, you'll enter in the ICD-10 code, anatomic group the patient is being treated for, and the patient's surgery status. You have the option of including a secondary diagnosis as well, but only primary is required. Again, click Next to save and advance to the next phase. Once you reach the intake phase, most of the information here is pre-populated with the patient's responses from their outcome assessment. You didn't have to score, add, divide, nothing. Everything the patient completed is scored and entered here automatically. If you want to modify comorbidities, this is where you can check the appropriate boxes. But otherwise, simply click Save and Close to complete the evaluation portion of the registration. When done correctly, following the workflow we just went through, your registration will show a phase status of intake. This is where the registration needs to be in order for it to automatically update with subsequent assessments you collect. For example, when you queue an interim assessment and the patient completes it, the phase status will now automatically update to interim. If you queue a discharge assessment and the patient completes it, the phase status will update to discharged, and the registration will be ready for reporting when the time comes. If the phase status on your registration says anything other than discharged, it will not be included in reporting at the end of a quarter. At this point, you're just continuing to queue assessments for the patient when appropriate. Note some of the changes in the queue patient assessment dialog now that the evaluation is complete. Now when you queue an assessment for the patient, you'll be asked to identify the assessment type, interim or discharge, the assessment date, the date the patient is being seen at your clinic and will be completing the assessment, and the visit number. Visit number should reflect the number of visits the patient will be on when they come in for their assessment. If a patient's already been seen for 2 visits and you're queuing them up for their appointment tomorrow, which will be the 3rd visit, number of visits will be 3. 2 more things you should be aware of. First, now that the evaluation is complete, you have the option of including the patient satisfaction survey. Many clinics struggle with self-discharges, so you may feel it's appropriate to collect the satisfaction survey earlier in the episode of care. If you want to collect it on an interim assessment, just check the box to include the survey. And second, if you want to email the assessment to the patient ahead of their appointment, check the Email to Patient option and click OK. Not too bad so far, right? No doubt you're aware, but challenges will ensue when you make a change to your processes or workflows. Following are some scenarios you might face along the way, and hopefully being aware of these will help you to make an easier transition to the new process. The next few slides will cover these common scenarios: getting the correct access code for the patient, requeuing an assessment in case a patient reschedules, how to deal with self-discharges, and how to transfer an interim assessment to discharge. First, when you look up a patient access code in the patient assessment queue, make sure you get the correct code. The biggest reason why you might have a login fail is because you either miskeyed the access code or you grabbed the access code for a different patient. As the screen here indicates, ensure that the access code is correct and that it's for the right patient. In the same vein, make sure you have the correct date of birth. This is perhaps one of the biggest reasons we get support calls. If date of birth was keyed in incorrectly when you first entered the registration, the login code won't work if the date of birth you're keying in now is different than what was entered earlier. It's important to double check that the date is correct. How do you verify the date of birth that was entered previously? You don't want to open the registration. Otherwise, as you'll see in the next couple of slides, you'll remove the patient from the assessment queue. To avoid accidentally removing the case from the queue, you'll want to check the registration summary to see what date of birth was entered for the patient. To do this, right-click on the patient registration and select the Print Registration Summary option. When the summary opens, scroll to the bottom of the page and click on the plus symbol next to the Patient Information heading to open the Patient Information block. Look at the date of birth and ensure it's correct. If it's correct, try again. If not, then you need to edit the information. Let's keep going to see how you can accomplish this. Next, imagine you entered the wrong date of birth like we discussed in the previous 2 slides, or you queued an assessment for a patient and the patient reschedules or cancels their appointment. Typically, this means that the original evaluation date has passed and the login will have expired. These are common scenarios you'll likely encounter and will require you to remove an assessment from the queue and get another one ready for the patient. There are two ways to remove an assessment from the queue. First, you can open the registration by double-clicking on it in your patient list. If you do, you'll get a prompt like this, warning you that the queued assessment will be removed from the queue if you continue to edit the registration. Continue by selecting Remove from Queue. Now you can go back to the Demographics tab and edit the evaluation date, date of birth, evaluation date, or make any other necessary edits before queuing the assessment again. The second way to remove an assessment from the queue is to go to the Patient Assessment Queue link here. Once there, right-click on the queued assessment and select Delete. This will remove the assessment from the queue. But please, please, please be careful not to delete your entire registration by accident. Some clinics have done this because they didn't pay attention to where they were in CareConnections when they tried to delete something from the queue. Two things. First, if you're on the main active patient list and you right-click on a registration, the right-click menu is going to be much longer and the delete option actually says Delete Registration. If you select that option, you'll be asked twice over to confirm because you're actually deleting the entire registration. Don't do this unless you really want to delete the whole patient episode. If you just want to remove an item from the assessment queue, first make sure that you click on the Patient Assessment Queue link and then, as pictured here, you'll only have one right-click menu option, Delete. Because you're just removing this from the queue, you don't even have to confirm the deletion. You'll want to do a reality check before removing something from the queue though. If you emailed the patient their assessment and you then delete it from the queue, the patient's access code won't work anymore. If the patient canceled their appointment, then it shouldn't be a problem. But if the patient just rescheduled, you'll want to notify them that they'll be getting a different email for the assessment you're queuing for them on the new date that was just scheduled. Another scenario to be aware of is that patients will sometimes select a completely inappropriate body region by mistake when they go to complete their assessment. Maybe someone accidentally clicks on neck, middle back, which appears as cervical thoracic when you view your outcome results, instead of knee. If you realize this after the assessment is complete, you'll need to have the patient complete the assessment again. If so, you don't need to delete the registration, you just have to re-administer the evaluation. To do this, right-click on the registration and select Queue Patient Assessment. In the Queue Patient Assessment dialog, select the assessment type Re-administer Evaluation. If you want to email the assessment, check that box as well, and then click OK. Based on the scenario we just discussed, in our example earlier, we would remove the option for neck, middle back, or cervical thoracic from the list of options, and the patient would have to select from what is left. Now we'll move on to issues surrounding the discharging of patients from CareConnections. From this cartoon, you may guess that a good portion of your discharges are not necessarily planned discharges. One scenario you may encounter is a patient who completes the evaluation assessment but never gets another one before they decide they're not coming back. These cases in CareConnections still need to be discharged. When all you have is the evaluation assessment, you'll open the registration and proceed to the discharge phase. So long as you followed the workflow we've discussed to this point, you just have to click on the Next button to bypass the interim phase of the registration. Once on the discharge phase, enter the discharge date, last date the patient was seen in your clinic, check the patient self-discharge box, select a self-discharge reason from the list of options, and enter the number of visits the patient was seen for in your clinic. This will complete the record and make it available for reporting at the end of the quarter. It also ensures that the record will be archived from your active list the next time we run quarterly reports. And the data will be used in the self-discharge report you have access to in your quarterly reports. So what if you've collected 2 or more assessments from a patient when they suddenly stop coming to treatment? This is still considered a self-discharge, So to close and discharge the case, you're going to use the last interim assessment you collected as the discharge. To do this, open the registration and go to the discharge phase. Check the patient self-discharge box, select the self-discharge reason from the list of options, and check the Use Last Interim Assessment box. When you check this box, all of the data from the last interim assessment pulls forward to populate the discharge fields. Note that the number of visits will match the visit number at which the interim assessment was given. This ensures that your reported function and pain change are accurately tied to the number of visits it took the patient to reach that point. To complete the discharge, click on the Save and Close button. This registration is now officially discharged and ready for reporting. Sometimes you might queue an interim assessment for a progress check, and the therapist later decides to make that visit the discharge visit. No problem. This is one of the easiest changes you'll have to make in a CareConnections episode. All you have to do is open the registration and go to the interim phase. Here you'll see a list of assessments. To transfer the last interim assessment to discharge, simply right-click on the last assessment in the list and select Transfer to Discharge. After you select Transfer to Discharge, the discharge phase of the registration will open and auto-populate the fields with the values from the interim assessment. Click on Save and Close to complete the registration. Super easy, right? Nice job, you made it. To briefly review, here are the things we hope you walk away with after sitting through this webinar. Why should you change from paper collection to using a tablet in CareConnections? At its most basic level, it makes your job easier, and the collection of data is much easier and more efficient. Next, making this change does require a change in your workflow. When you change to electronic collection of outcome data, your workload shifts toward the start of care, pre-evaluation through post-evaluation. After that, we showed you how to do it, how you set up your device for collecting assessments in your clinic, how you queue assessments, and how you complete the evaluation portion of the CareConnections registration. And finally, we realize that there will be challenges that you'll run into with making this kind of change. We covered a few scenarios you'll want to watch for, including things like completing all of the evaluation fields that are essential to being able to discharge your patient episodes, and how to deal with cancellations and rescheduling patients. You'll likely encounter some unique challenges as well, depending on your setting, patient load, and other factors. So if you have questions, please feel free to reach out to us. You can email support@careconnections.com to contact our team with questions or technical support issues. You can also contact me, I'm Steve Pearson, or Heather Coven if you have questions or would like to schedule a time to chat in person. Thank you all for your time, and we hope this helps with your transition from paper to electronic data collection in CareConnections.